Hey everybody, many of my patients will ask me how much bend should I have in my knee after I get my knee replacement surgery, or how much flexion should I have? That's the official term of bending your knee flexion. So my answer is it depends. So ultimately, the end result, end goal by the end of it all is 120 degrees of knee flexion. Okay, so if we imagine we're sitting in a chair and our feet are flat on the floor and our knees are bent at that right angle, that's 90 degrees. So we want it further beyond that, such that, like, if you were sitting in the chair, you could put your feet underneath the chair, your knees would bend enough. That's the ultimate goal. But how many degrees should you have a couple of days after surgery, weeks after surgery, 6 months after surgery? Well, there are a lot of factors that go into it. So typically what I like to see is in the first 2 weeks after surgery, you should have 90 degrees. It's pretty much going to stay there because of swelling, the healing process. Your body has just gone through this quote unquote trauma because of the surgery. So it usually hovers around 90 degrees. I like to see 90 degrees the day you leave the hospital, and then it usually sticks around there over the next 2 weeks or so. By that third week, you should be getting about 95 degrees. And each week after that, you should get about 5 more degrees, depending on your situation. If you need to gain extension, making that knee go straighter, you're not going to gain as much flexion and as much knee extension at the same time. It'll go kind of back and forth, whatever you're really focusing on. So that is one determinant. How long has it been since surgery? So by week 3, you should start gaining about 5 degrees of knee bend each week. Another thing that you should take into consideration is how much knee bend did you have before surgery? That's a big determinant on how much knee bend you're going to have after surgery. If you couldn't bend your knee before surgery, it's not going to magically bend after surgery. Yes, the surgeon does bend it forcefully in surgery to stretch things out, break up any scar tissue that may have formed over the years, and get you bending. And they'll tell you how much they got in surgery, and they hope you get that beyond surgery afterward, but it's not a guarantee. So if you had a big problem bending your knee before surgery, you're going to have a tough time getting it bent after surgery, because the surgery itself just takes out the arthritic part of the bone. It doesn't stretch the muscles. It doesn't stretch the ligaments or the tendons. Those you have to work really hard at. So that's another thing that will factor in to see how much knee bend you have, how much knee bend you have before surgery. And then another thing is, how large is your leg? Is it swollen? Because that's one factor. Or is it just, are you overweight? Is it a big leg? Because you can only bend as much as you can before your calf and the back of your thigh start touching. That's as far as it's going to go. There's no more room there. So if you have a big leg, that's going to make it so it doesn't get as much knee bend as somebody else who has a smaller leg. So losing some weight can help make you bend your knee more, or have the availability to be able to bend your knee more. Again, losing weight doesn't change how flexible your muscles, tendons, and ligaments are, but it gives you that availability. There's more room to move. And then going back to swelling, if your leg is really swollen, again, your calf and the back of your thigh are going to be touching. So there's only so much room to go. So getting rid of some of that swelling will help. Ice helps that, increasing circulation helps that, and drinking a lot more water. Your body holds on to fluid when it doesn't know when it's going to get the next round of fluid. So it holds on to it. If you keep a constant supply, it doesn't need to hold on to it because it knows it's getting um, some fluid there. And then, another thing that helps determine how much knee bend you're going to get is how long ago was surgery. Again, talking about how long ago was surgery. If it's been years since surgery, you're probably at where you're going to get, unless you had a new injury. So I hope that was helpful. Determinants on how much knee bend you're going to have. So you want to get to 120 degrees. Usually it's 90 degrees in the first 2 to 3 weeks. After that third week, you should start gaining about 5 degrees each week. All depends on how much knee bend you had before surgery, how long ago was surgery, And how big is your leg? Do you have a large leg just because you're a large person? Do you have a large leg because it's swollen? All of these things play a factor.